Hey there, this is Dr. Mike Stair. I'm going to go over 3 ways to mobilize your ankles. Really, there's going to be 2 stretches that we go over in one mobilization. We'll go over the distinction of those in just a minute. First, let me show you a common stretch that probably needs just a couple little technique things to clarify to make sure we're doing it correctly. The gastroc soleus stretch, otherwise known as a calf stretch. In order to do that, you stand with both feet parallel to one another. A common error is that the back foot that we're stretching is turned out to the side. That's not going to be the best way to mobilize the desired structures, the Achilles, the gastroc, the soleus. So keep the foot exactly parallel to the other foot or perpendicular to the surface that you're leaning on, if it's a wall or in this case a bench. The back leg, the stretched leg should be straight and move forward. Translate both your hips forward, keeping your heel in contact with the ground until you feel a stretch. Most people have done this fairly well before. You get a far better stretch if you don't toe out. Instead, if you keep your foot in what we call talar neutral. And then again, bring your hips forward. The second stretch is known to target more the soleus versus the gastroc. The distinction is that of these 2 calf muscles, both insert through the Achilles. One has an attachment below the knee, and that's the soleus. The other has attachment above the knee, and that's the gastroc. That's why the soleus is technically preferentially targeted if your knee is bent. So in order to do that stretch, the affected leg, in this case the left leg, is bent. That theoretically slackens the gastroc, instead diverts more of the stress on the soleus. In doing this stretch, you may find that you don't feel as much of a pull, or the sensation you feel instead is a blocking or a stiffness in the front of the ankle. And that's what we see with a lot of people. In fact, the number 1 reason why we ask people to mobilize their ankles is not usually due to tight gastroc soleus muscles, but instead the joint, the talocrural joint in particular. A great way I think of it is imagine a screen door. You have 2 things that keep it from swinging wide open. One is the hinge, and the other is a hydraulic arm that keeps the door from swinging too far open. Stretching the muscles is like targeting the hydraulic arm, but stretching the hinge is like mobilizing the joint. And that's what is impeding a lot of folks' mobility that can affect anywhere from their knees to their hips to their whole body movement. So a way to mobilize the joint, instead of taking it to the end range and holding it for prolonged periods of time, you often take it to the end range and oscillate it. A joint, in order to be mobilized, is found to be best mobilized by oscillation at end range, as opposed to a prolonged hold or stretch, as if you're trying to affect a muscle or a tendon. So here's how to do the ankle mobilization at the talocrural joint. Exact same position as that soleus stretch. Again, making sure that the foot is parallel to the other, it's not toed out, so in talar neutral. Here, you're going to keep your weight firmly on the trail leg, the one you're trying to mobilize. I'd say about 90% of your weight's going to be on that leg. Heel's going to be in contact. Bend the knee forward until you feel you're at maximum stretch. And once you're there, or I should say maximum motion, once you're there, you're oscillating at the end range. Low amplitude, back and forth. It's not through a wide range motion. Instead, you go at the end range and oscillate there. Shorter periods of time, typically we see 10 sets, 10-second mobilizations. That's a great way to get adequate stimulus to the tissue. You can experiment with different time frames. It's probably not going to make a huge difference in terms of effectiveness. But consider how physical therapists, chiropractors, osteopaths mobilize joints when they're not doing a high velocity thrust. They take the joint to end range and they oscillate there. So that's how we should treat this as an ankle mobilization. Also, doing it with your full body weight is critical. Obviously, there are manual ways to do this too if you have somebody that's a skilled therapist helping out. But it's far more effective when you're doing it on your own and you're using the full weight of your body weight, because of the mechanical advantage of that joint is quite high. So you need a decent amount of weight in order to get the adequate mobilization. This works far better than using something like a strap or a band, where it's just very difficult to get enough leverage. All right, hope that helps. Hope you get more mobile ankles. Thanks.